afternoon, everyone. My name is Madison Bradford, and I am a senior public health major with a minor in Spanish here at Georgia State University. Everyone wants to have a safe and healthy child during childbirth. So why is that not a priority in our healthcare system? Today I will be discussing the mortality rate of Black women, Georgia's mortality rate of Black women during childbirth, and how Black maternal mothers are facing discrimination and systematic racism in our healthcare system. Black women have a higher mortality rate than white women. That is the most inhumane thing and issue that is ongoing in the United States, and it only pushes me to do more. Racial and ethical disparities also play a huge role in the mortality rate of Black women during childbirth. According to the CDC, at least 700 women die in the U.S. from complications during childbirth, lack of proper medication and treatment, as well as not being looked after from their nurses and other healthcare personnel during their roundings. Now we'll discuss how the mortality rate of Black women is at its peak in Georgia, especially amidst the new circumstances of the COVID-19 pandemic. Most counties in the state of Georgia have little to no access to OBGYNs or even proper screenings or access to ultrasounds for Black maternal mothers in the state of Georgia. According to the American Civil Liberties Union, Black women's death rate is 2 times more as white women nationwide. That, by far, is the most insane thing that we could face as a nation, and we should be doing everything in our power to decrease this issue. We are all human beings. As a Black woman myself, I know I want my healthcare to be put first, and I would want my healthcare personnel to treat myself and my future child the same way. Moving on to a new point, I will be discussing how maternal patients in lower income communities face discrimination in healthcare as well as systematic racism. Statistics show that in 2018, there was a large increase in maternal deaths. So we are all currently in 2021. So that's about 4 or 5 years later, and we're still going through the same issue. And in fact, 2021 is the year where maternal mortality rates of Black women are actually at its highest. Because we are amidst this pandemic, these maternal mothers are not able to have loved ones and family members in the room with them. Nurses aren't taking the extra emphasis on extra initiative to check on their maternal patients before, during, and after childbirth. Systematic racism in the healthcare system as it pertains to Black maternal mothers is an ongoing issue. It's up to us, communities, and local government officials to help alleviate this issue so that everyone has the fair treatment in healthcare and during childbirth that they deserve. In conclusion, the Black mortality rate of African American women in the healthcare system is skyrocketing by the minute. It is up to us to make this change and to take affirmative action to decrease this rate. Being someone that has lived in Georgia now for 3 years, I've seen firsthand how impactful Black maternal mothers and their mortality rate has been. Seeing friends and close loved ones' lives just change drastically amongst being in the pandemic just because healthcare couldn't take one extra step to put them first. It is sad, it is inhumane, and it's disheartening to see all of these women losing their lives because their healthcare priorities and their healthcare needs are not met. So answer me this. If this was your loved one, if this was your wife, friend, girlfriend, what would you do to make sure that their healthcare priorities are met so that they do not have to deal with the stress of having their rights to healthcare denied. And you could be a help to the decrease of the mortality rate. I thank you all for taking the time out to listen to my speech, and I hope by hearing what I had to share with you all today that it impacts you to go out into the world, be an advocate for these Black mothers, and also put your own personal health care needs first.